Good afternoon, everyone. Thank you for joining today's workshop on A to Z of OCD or Obsessive Compulsive Disorder, which we call. Okay. So today we'll journey through understanding this condition from its origin to evidence-based treatments and daily coping strategies. Let's create a safe, respectful, and interactive space as we move forward. Introducing myself, my name is Pranali. I am the psychologist at MindTribe. I do take therapy sessions and I specialize in anxiety, stress, depression, self esteem, confidence issues, relationship issues, and much more. Okay, so also we have our co host today, Fatima. So she is also a psychologist at MindTribe. She is very good at taking the sessions and helping people out. So yeah, you can reach us out if you want the session. Okay. All right. Moving ahead. Okay. Let's look at the few ground rules for today. Um, Before we begin, let's see those. So please keep your audio and video off unless you are participating. Be respectful of everyone's journey, listen actively, and allow space for others to share. Let's make this a safe and inclusive environment. Okay. Also, if you want to participate, if you want to speak something, you can raise your hand. As we will move ahead, we'll ask you to speak. Okay. Do not switch on your mic unless and until asked. All right. Just so that we do not get any disturbance throughout the workshop. All right. Okay. Starting with the main topic, OCD. What is OCD? Okay. So basically, it's called obsessive compulsive disorder. Okay. So, okay. So before starting, have you ever met someone with OCD or experienced it yourself? Just give a thumbs up if any of this is true for you. Yes. Many people I see are giving the thumbs up. You have seen it. You have seen the symptoms, how it goes, how it is, right? Okay. Maybe someone double checks the locks obsessively, or someone avoids touching things due to fear of contamination. So these behaviors can sometimes be misunderstood or minimized. Okay. So today we aim to truly understand what's happening beneath the surface. So these two things that I told are on the surface, but what's happening inside, that we are going to see. Okay. All right. Okay. So what is OCD? Anyone who wants to type it in the chat box, what is OCD? Or if you want to raise hand and speak out loud, you can. Yes, Ami. Please go ahead. Gautam,
As
could
we
you
can say,
please? Sorry, just one sec. Gautam, could you please switch off your mic? Yes, Ami, continue.
as we can say, we are, very particular about the things and how the way it is arranged.
Okay, I get it what you're saying. It's partially true, right? Let's look at it. What is OCD? Okay, all right. So there are two things. There's obsession, there's compulsion. So basically, OCD is a mental health condition characterized by obsessions and compulsions that interfere with our daily life situations. Okay, so OCD was formerly classified, it was before anxiety disorder. It was called as anxiety disorder. But as we experience a severe anxiety as a result of obsessive thoughts, we also engage in rituals in an attempt to reduce the anxiety caused by those obsessions. Okay. All right. So basically, in this obsession, is we have constant thoughts in our mind, the recurrent, intrusive, and distressing thoughts that urges or images are there continuously. To do this, to do that, or that will happen to me, this will happen to me. These kind of thoughts are there. This kind of obsession is there in our mind. Okay. What is compulsion? So compulsion is whatever comes in our mind, or whatever thoughts are coming, or whatever images are coming, we try to do that repeatedly. We have that repetitive behavior to reduce that anxiety caused by that obsession thought, that obsessional thought. Okay. Okay. So looking at the evolution of OCD. Okay, so initially in the ancient days, it was seen as the spiritual issue, the religion issue, but today we see it as a mental health condition, right? Okay, yes. So what used to happen in ancient times? It was considered as possession or sin. So unusual thoughts or compulsive behaviors were often attributed to demonic possession, evil spirits, or divine punishment. So, what was the interpretation in this of it was the OCD symptoms are seen as signs of moral failing or spiritual impurity. People used to think it's pure, that's why the person is like this. Okay, so what people used to do is fasting, chanting, or offerings. They used to do these kind of things as a treatment, the purification rites. Okay, the impact was the person was often isolated, blamed, or even punished rather than understood or helped medically. So there was no medical help in this case. So people were totally isolated in this case. Then coming to the middle age. So middle age, it was more of religious obsession. Okay. So OCD symptoms are often seen through the lens of religion, especially in Christian Europe. Okay. So intrusive thoughts were viewed as sinful temptations or signs of weak faith. So treatment in this was the confession and repentance. Okay. So flagellation, the self punishment that we call the self punishment was there a lot. Then excessive prayer to atone all to atone for thoughts. To put all together the thoughts. And the relevance was many people with OCD religious or moral obsessions, which may have historical roots in these periods religious atmosphere. Okay, moving ahead. So third thing we had was Renaissance. The Renaissance period. It's just a personality issue that they thought at that time. Okay. So in that period, people moved towards more secular ideas through superstition remain. So repetitive or peculiar behavior was often seen as a quirk of personality or imbalance in bodily humors. Okay. So treatment was removing the bad blood or herbal remedies or soothing baths or music. So these kind of things were there. So there was a growing interest in the mind and behavior, although medical science was still primitive. So there was nothing from science side, as we can see. Okay. Then coming to the 1700s and 1800s, in that case, the mental illness begins to be recognized. So mental health was somewhat the other way coming up. Okay. The spark was there, the birth of psychiatry was there was medication, there were mental health. Obsessive compulsive behaviors were recognized as a part of broader categories of madness or melancholia. Okay. So the treatment was confinement in asylums, moral therapy, that is structured routine for them, or some early forms of talk therapy. Okay. So OCD began to be seen as mental illness rather than moral or spiritual failing, which was very good sign. Okay. Then next was coming to the 1900s. So here OCD gets a name and treatment. Finally coming to a better part. So Sigmund Freud interpreted obsessive thoughts and compulsive behaviors as a result of unresolved childhood conflicts and repressed desires. Okay, so OCD is seen as a form of neurosis. Okay, so in this, the treatment was talking or looking into their this what do you say, unconscious mind, and also dream analysis was there. Well, Freud brought focus to internal world. Treatments lacked scientific rigor and were often ineffective. Okay. Yes. The person is raising hand. Do you want to say something? Okay. So coming to the 1960s and 1980s. Okay. So yes, I'll be explaining what insanity here means. Okay. So symptoms are driven by intense anxiety, not delusion or psychosis. So people with OCD recognize their thoughts as irrational, but feel unable to resist them. Okay. So what insanity in this case means is, before people thought it's a people are mad, people are going melancholia. So that is called as insanity. That's why the insanity was put aside and more it was referred to as anxiety disorder. All right. And there were use of medications, and where slowly it came into the mental health part. Okay. Now looking at today. Okay, what is happening today with OCD? So OCD as a treatable brain-based disorder. Okay, so it is a neurobiological condition involving overactivity in certain brain circuits, neurotransmitter imbalances, especially the hormones serotonin and dopamine, and influenced by genetics, environment, and cognitive styles. Okay, then the treatment today we have is evidence-based therapy, that is CBT and ERP. SSRIs or other pharmaceutical options are still there. We also use mindfulness based therapies. Lifestyle modifications are done, psychoeducation is done, which helps people a lot. Okay. So the perspective today is OCD is seen as manageable and treatable, with many individuals leading full and functional life. Okay. Okay, let's go through before we move ahead. Okay, ancient time, it was more of spirits and gods, possession and sin, the demonic or spiritual belief. Then coming to middle age, it was religious, the sinful thoughts, and the prayers and punishment was the treatment. And coming to the Renaissance period, it was more of personality imbalance, quirks or humor based, and the treatment was removing the bad blood and the herbal treatment. Then coming to the 1800s, it was mental illness called as madness, and the asylums were the option for it. And then 1900s, it was more of psychoanalysis, repression or inner conflict, and it was more of talk therapy treatment. Okay. And coming to today's part, it's more of neurobiological and environmental, and the treatment for this is therapy plus medication. Okay. All right. Let's look at the signs, symptoms, and types of OCD. So there's just one type of OCD, or the OCD is just one thing, but it's a huge umbrella. Okay.
Hello.
Right. Yeah.
Sorry for disturbing, but I have one question.
Yes. Go ahead.
How they remove bad blood? I didn't got that point.
What did you say?
How do they remove bad blood? I didn't got
Okay.
that point.
Okay. So before in
And
1800s
does it work?
and sorry.
क्या वो help करता था? Does it work?
No. It didn't work. It was more of religious thing in 1800s. It was at that time in 1800s. People used it was more of religious belief. Having OCD, people used to think it's a madness, and it was not OCD. There was no such term at that time, OCD in 1800s. So people used to think it's more of a religious thing, and people used to prayer. Remove. They used to think there's bad blood inside that person's body, and they used to remove bad blood, so it was called like that. Okay, more of they used to pure that
How
blood.
they remove that bad blood? What was the
Um,
procedure?
the procedure, we don't go into that depth because we don't need it right now. But yes, it was a medical process which we do not follow now. All right.
Okay, thank you.
Yes. Okay. Moving ahead. So we'll be seeing ahead the signs, symptoms, and types of OCD. Okay. So looking at it, what are obsessions? Let's look at it. Okay. So, obsessions are intrusive and unwanted thoughts, images, or urges that repeatedly enter a person's mind, causing significant anxiety or distress. So, these thoughts are often irrational, but the person experiencing them finds it very difficult to dismiss them. Okay. So, some types of obsessions include, so here are few examples that I've written down. First one is fear of contamination. So this is when someone is excessively worried about germs, dirt, or getting sick. They may feel an overwhelming need to wash their hands, even after a brief contact with an object or surface. Okay. The next example here we have is doubts about safety. Okay, so this involves persistent concerns about whether something was done correctly, or like locking a door or turning off the stove, and much more. So the thoughts are, did I lock the door? May keep coming back even after checking multiple times. Okay. The next is intrusive thoughts about harming oneself or others. So these can be very distressing thoughts about hurting ourselves or the other person, even when there is no intention to act on them. Okay, so we don't have anything in our mind, but we have that thought, constant thought that to harm someone or ourselves. For example, a parent might have an unwanted thought about accidentally harming their child, which can be extremely distressing. Okay. Next example we have here is need for symmetry or order. The people are very, very organized. So this involves feeling uncomfortable if things aren't arranged in a certain manner. A person might feel compelled to keep objects perfectly aligned or repeat an action until it feels just right. Okay. So it's important to note that having an occasional intrusive thoughts is normal. Everyone experiences them. But for someone with OCD, these thoughts are persistent, uncontrollable, and lead to extreme anxiety. Okay. The distress caused by these obsessions is what drives compulsive behavior, which we will talk about next. Okay. So this is what we talked about is obsessions. Next is compulsions. Okay. So let's see what compulsions are. So basically, compulsions are the repetitive behaviors or mental rituals that a person feels driven to perform in a response to an obsession. Okay. So these actions are intended to reduce anxiety or prevent a feared event. But the relief is only temporary, leading to a cycle of obsessions and compulsions. Okay. So let's look at a few examples in this again. So first is excessive hand washing or cleaning. This is common in people who have contamination obsession. Okay. So they may wash their hands repeatedly or clean their surroundings to an extreme degree, even when there is no real threat. Then next example might be checking things repeatedly. Okay. So this is done to ease doubts about safety. A person may check door locks, appliances, or even their work assignments multiple times. So fearing that may have made a mistake. Okay. Then next is arranging items in a specific order. So some people feel the need to place objects in a certain way, like aligning books perfectly or organizing items symmetrically until it feels right for them. Okay. Then next is mental rituals. Not all compulsions are visible. Okay. Some people engage in silent mental rituals also, such as counting, praying, or repeating words in their head to prevent something bad from happening. So, this is also the compulsive behavior. So, in this case, what's important to understand is that these compulsions provide only temporary relief. So, over time, they become exhausting and interfere with daily life. So people with OCD often realize their compulsions don't make logical sense, but they still feel powerless to stop them. Okay. So this is what makes OCD debilitating. So it's not just about being extra clean or liking things in a certain way. It's about anxiety and distress that drive these behaviors, making it difficult for a person to function normally. Okay. So this is what compulsive behavior looks like. Okay. All right. So looking at the OCD cycle. So OCD is not just about cleanliness or perfection. It is a serious and often debilitating cycle. Okay. So the cycle starts with obsession. So which are unwanted intrusive thoughts. So these thoughts create anxiety, leading to emotional distress or discomfort. So in in response, a person engages in compulsions, which are repetitive behaviors, right? Or rituals meant to reduce that anxiety. So, however, any relief from this compulsion is only temporary and soon the cycle begins again. Okay. So, this cycle keeps reinforcing itself, making it difficult for individuals to break free without proper treatment and support. Okay. So, now that we have understood the obsessions and compulsions, let's take a closer look to how to interact and form a cycle that keeps OCD going. So this cycle considers four things. Okay. The obsessions, anxiety, compulsion, and temporary relief. Okay. Which then repeats over and over again, making OCD stronger. Okay. So obsession here means is because the cycle begins with intrusive and distressing thoughts, image, or urge. So this thought is unwanted and causes significant anxiety. Then coming to the anxiety part here. So there's emotional distress. All right. So because thought is disturbing, it triggers intense anxiety or discomfort. The person feels overwhelmed and distressed, often believing something bad might happen if they don't take action. Okay. So then coming to the compulsions. So compulsions is to relieve the anxiety. The person performs a repetitive behavior or mental ritual. This action provides short term relief, but it reinforces the obsession over time. Okay. The next part is temporary relief. Okay. So the compulsions reduce the anxiety for a short while, but it does not remove the obsession. In fact, it strengthens the OCD cycle, making the person more likely to rely on compulsions in the future. Okay. Okay. So what we have seen here is let's consider an example for this. Okay. So a person with OCD touches a doorknob and suddenly has an intrusive thought. So what if this doorknob is covered in harmful bacteria? What if I get sick or spread germs to my loved ones? So this thought is not just a casual concern, but it feels extremely urgent and distressing. Okay. Then next thing is anxiety. So in this case, what happens is this thought causes immediate anxiety inside us. The person might start imagining the worst case scenario, falling sick, ending up in hospital, or unknowingly harming others. So this distress became unbearable, making them feel that they must do something to prevent this imagined danger. Okay. Then comes the compulsive behavior here into the picture. So to relieve this anxiety, the person rushes to wash their hands, but instead of washing them once, they scrub their hands multiple times, maybe using soap, hot water, the scrubber, anything. So making sure they feel completely clean. If they still feel uncertain, they might repeat the process. Okay. And The final thing is the temporary relief, the few. I feel better now. But what if I missed a single spot? What if I missed the finger of washing it? Okay. So after washing the hand, the person feels temporary relief. The anxiety is gone and they feel safe. However, this relief is short-lived. Soon another thought might pop up. What if I didn't wash properly? What if I missed this spot? Cycle starts all over again, reinforcing the compulsive behavior all over again. Okay, so this was a short example. Alright, so let's look at the common signs. Okay, so now that we have discussed obsessions, compulsions, and the OCD cycle, let's see the signs one by one. So it can help understood when normal behaviors cross into OCD territory. Okay. So it's important to remember that OCD isn't just about being tidy, checking things, or worrying. It's about intense distress and compulsive actions that disrupt daily life. So let's go through these signs in detail. Also, we'll look at the example for it one by one. Okay. So first one is spending a significant amount of time, more than an hour or a day, dealing with obsessions or compulsions. So everyone has intrusive thoughts occasionally, and we all engage in small habits or routines. However, in OCD, these thoughts and behaviors consume a significant amount of time, often more than an hour a day, causing distress and interfering with daily life. So, for example, example of normal behavior in this case would be double checking if the door is locked before leaving the house. Example of OCD behavior would be spending hours checking locks, lights, or appliances repeatedly because of an overwhelming fear that something bad will happen. Okay, that's the difference. Okay. Okay, the next example we might see here is example of normal behavior in this case would be washing hands after using the restroom or before eating. Okay. Example of OCD behavior in this case would be spending long periods washing hands repeatedly, scrubbing them until they are raw because of intense fear of germs. So the key difference in this time spent and distress caused is if the behavior takes up excessive time and disrupts daily functioning, it's a warning sign of OCD. Okay. Second one, feeling lack of control over these thoughts and behaviors. People with OCD compulsions behavior. They enjoy them. They do so behave, they feel like they have no choice. Their brain convinces them that if their brain convinces them as if they have don't know any choice. They have to perform the compulsion. Something bad might happen, and this creates extreme anxiety. Okay. So, example of normal behavior in this case is deciding to organize a shelf because it looks messy. An example for OCD behavior might be feeling forced to arrange items in a perfect symmetrical order and experiencing extreme discomfort or anxiety if they are slightly misaligned. Okay. Another example is saying a quick prayer before an exam for good luck. This would be a normal behavior. But for example, for OCD behavior would be feeling compelled to repeat a prayer exactly 10 minutes, 10 times in the same way and believing that if it's not done correctly, something bad will happen. So this lack of control over one's mind and actions is what makes OCD so distressing. Even when people recognize their thoughts are irrational, they feel unable to stop acting on them. Okay. Then next is experiencing distress, guilt, or shame about one's thoughts or actions. So many people with OCD feel deeply ashamed of their intrusive thoughts or compulsive behaviors. They may have fear, judgment from others, or even believe that their thoughts mean something bad about them. So this can lead to extreme guilt and self-criticism. For example, normal behavior would be having a random disturbing thought but quickly dismissing it. But OCD behavior would be having a disturbing intrusive thought. For example, what if I punish someone onto the road? And then obsessing over it for hours or days, questioning whether they are a bad person or not. Okay. So this stress and guilt can make OCD even more isolating, as people may feel ashamed to talk about their struggles. Okay. So fourth one is avoiding situations or objects that might trigger obsession. So many people with OCD start avoiding certain places, people, or activities to prevent their obsessions, thoughts, and from being triggered. So these avoidance can significantly restrict their life and prevent them from doing things they enjoy or need to. For example, normal behavior would be using hand sanitizer after touching public surfaces. But the OCD behavior in this case would be avoiding places altogether, refusing to shake hands, or wearing gloves indoor because of an extreme fear of contamination. The avoidance may feel like temporary solution, but in reality, it often makes OCD worse by reinforcing the fear. Okay, so the fifth one, the last one, decline in productivity, social interactions, or personal relationships due to the disorder. So, OCD doesn't just affect an individual's mind, it affects their entire life. The excessive time spent on compulsions and obsessions can impact their work, school, friendships, and family relationships. Okay. So normal behavior in this case would be occasionally running late due to getting distracted. The OCD behavior would be constantly running late or missing an important event because of compulsions. For example, checking the stove 50 times before leaving. Okay. So some people with OCD may even struggle to hold a job or maintain relationship because their compulsions take over so much of their time and energy. Okay. So the next thing we are going to see is types, symptoms of OCD. Yes, Ranu, you want to say something?
Yes, I have a question.
Okay, go ahead.
I am not able to understand what is compulsion.
Okay, I'll explain it for you. Just give me a second. Okay.
Thanks.
This,
Okay, okay.
so basically, compulsions is a repetitive behavior that a person does because of the thoughts that they have in their mind. The repetitive thoughts make them do the repetitive behaviors. Okay, so the person feels driven to perform in response to their obsession. So these actions are intended to reduce their anxiety or prevent a feared situation or event. So this relief of having compulsive behavior is temporary, okay, leading to a cycle of obsessions and compulsions. Okay, so this was about compulsion. Coming,
Okay, thank you.
yes, you're welcome. Moving ahead, the symptoms of OCD. So we have already seen these examples of symptoms about obsessions and compulsions. Okay, we have seen fear of contamination due to germ or dirt, the fear of having that. We have seen intrusive thoughts about harming oneself or the other, need
Hello,
for
ma'am.
symmetry, uh, or having the
I want to ask
behavior of
something.
arranging. Yes,
Please talk about pure OCD.
yes. We are going to talk about it. We'll be
Okay,
coming.
thank you.
Yes. People, if you have any questions, please drop it in the chat box. We'll be addressing it in the end. Okay. Okay. So the symptoms here are for obsession, arranging things, then having disturbing taboo thoughts about religious or violent or sexual thoughts. Okay. Then compulsions. There's excessive cleaning or hand washing. So that leads to the emotional impact of feeling shame, guilt, and isolation. Then checking locks, the intrusive thoughts. So it has constant anxiety and frustration from incomplete rituals. Okay. Arranging things, counting, tapping, or repeating specific actions. So that leads to fear of judgment or anxiety, these kind of things. Okay. Okay. Coming to the types of OCD. All right. So now let's take a closer look at different types of OCD and While OCD manifests in different ways for different people, researchers and mental health professionals have identified few of the common subtypes. Okay, let's go through them one by one. So first is contamination or cleaning OCD. So this is one of the most well-known forms of OCD. So individuals with this type of experience have an intense fear of contamination. They may believe that touching objects, shaking things, or even breathing in certain environments could expose them to harmful germs, dirt, or toxic substances. As a result, they engage in compulsive behaviors to neutralize this perceived contamination. For example, excessive hand washing or showering, avoiding public places, overuse of cleaning products, changing clothes excessively and continuously. It's important to note that the distress here is not just about cleanliness, rather, it's the anxiety associated with the fear of being contaminated or spreading contamination. Okay, coming to the second one, symmetry or order OCD. Okay, so people with this type of OCD feel an overwhelming need for symmetry, exactness, or things being just right. If something feels off, they may experience extreme distress and anxiety. Okay. For example, arranging objects symmetrically, repeating actions until they feel just right. For example, tapping a surface an exact number of times or rewriting something multiple times. Then fixation of even numbers or patterns. So this type of OCD is not just about neatness or being a perfectionist. It's about being an unbearable internal discomfort when things are out of order. Okay. Then the next one is hoarding OCD. Okay, so unlike general hoarding disorder, hoarding OCD is driven by obsessive fears rather than just difficulty discarding. So, a person with hoarding OCD might believe that throwing something away could lead to severe consequences, such as losing important memories, needing the item in the future, or even causing harm to someone. So examples might be keeping excessive amounts of unnecessary items with us, extreme distress at thought of discarding something, and organizing but never disposing the things. Okay, so this subtype often affects a person's living space, making it cluttered and sometimes unsafe. But the underlying fear is what differentiates it from general hoarding behavior. Okay. So the next is checking OCD. So people with checking OCD experience obsessive fears that something bad will happen if they don't check things repeated. So they may worry that they have made a mistake, forgotten something crucial, or caused harm unintentionally. Okay. For example, repeatedly checking locks, doors, or appliances, rereading emails or messages, to make sure that they have not made any mistake or accidentally wrote something offensive, and seeking reassurance from others. Okay. This form of OCD is driven by a deep fear of responsibility, fear of causing harm through negligence or making a mistake that leads to disaster. Okay. The last one, intrusive OCD. So, intrusive OCD is one of the lesser known but more distressing form of OCD. So it involves unwanted, distressing thoughts or images that go against a person's values, beliefs, or desires. So these thoughts are often violent, sexual, or disturbing in nature. The key here is that the individual finds these thoughts deeply unsettling and does not act on them. Okay. For example, harm OCD. Fear of losing control and harming a loved one, even though they would never actually do it. Then sexual OCD, then religious or moral OCD. So people with this form of OCD often feel extreme guilt or shame, even though these thoughts are involuntary and not reflective of their own true intentions. So these were the main subtypes of OCD. But it's important to remember that many people experience a combination of these symptoms. OCD is not just being about being clean or organized. So it's a serious mental health condition that can impact daily life in profound ways. Okay. So the good news is that OCD is treatable with therapy, especially cognitive behavioral therapy, exposure and response prevention therapy, raising awareness about these different types helps us better understand and support those living with OCD. Okay, let's take a case example in this. Okay, so Ramesh has difficulty throwing anything away, even old newspaper, broken electronics, and clothes he hasn't worn in years. Okay, he fears that if he discards something, he might need it later. His home is so cluttered that it's difficult to move around, but he feels anxious at the thought of getting rid of anything. Okay, so which type of OCD is this? Any idea?
Hoarding OCD.
Okay, I see many of them saying hoarding OCD. Okay, I see intrusive OCD. All right, let's look at the answer. Yes, the answer is correct. It's hoarding OCD. Great people. That's nice. Let's look at another example. So Priya avoids touching doorknobs, shaking hands, or using public restrooms. She washes her hands so frequently that her skin becomes dry and cracked. She feels extremely anxious if she thinks she has come into contact with germs, even if others assure her it's safe. Experiencing.
Contamination OCD.
Okay. Yes, many people are contamination. Great. Okay. Let's look at the answer. It's correct. It's contamination in OCD. Okay. Okay. Let's go through another example. Aman spends hours aligning the objects on his desk perfectly. If someone rearranges multiple times until it feels just right. If his books are not perfectly straight, he feels intense discomfort and cannot focus on anything else until he fixes them. Okay, what type of OCD is Aman experiencing?
Symmetrical OCD.
Okay, yes, all right. Many people are saying symmetrical. That's correct. It's symmetry or order OCD. Okay, great people. It's so nice that I'm hearing the correct answers from you all. That's very nice. Okay, another case example. So Sneha checks the locks on her doors and window multiple times before leaving the home. Even after checking, she feels a strong urge to go back and check again. She also feels repeatedly ensures. She also repeatedly ensures that she has turned off the stove, fearing that if she does not, something terrible will happen. So, which type of OCD Sneha is experiencing?
I think intrusive thought type OCD.
Okay, I say intrusive. I say checking. Okay. Okay. So the correct answer is checking OCD. It's correct. Many people have given the correct answer. Great, guys. Okay. Let's look at the next one. Okay. Raj often has distressing thoughts about harming his loved ones. Even though he has no intention of doing so, these thoughts make him feel guilty and anxious. Okay. And he engages in mental rituals to try to neutralize them. He often sharp objects and being alone with others, fearing that he might lose control. Okay. So what type of OCD is Raj experiencing?
Harm OCD.
Okay. Harm OCD, there's no such thing, but kind of, yes, intrusive OCD, right? Okay, let's look at the answer. Correct. It's intrusive thought OCD. Okay. So this was the last one. Okay, let's look at the case study. So Priya is 28-year-old software engineer struggling with OCD symptoms. that interfere with her daily life. She has fear of contamination, intrusive thoughts about harming loved ones, and has need for symmetry, leading to hand washing, hiding sharp objects, and rearranging her desk repeatedly. So triggers like public surfaces, kitchen knives, and disorganized spaces heightened her anxiety. So we see many types of OCD in this case. Okay.
Yes. Ma'am, you
Yes.
haven't talked about pure OCD. I am suffering from it.
Which OCD?
Pure O.
Pure OCD. So we are talking about OCD, but we have seen the types of it. Okay. So let's look
Oh,
at the triggers of it. All right. So a trigger is a stimulus that causes a strong emotional or psychological reaction, often related to a past trauma or significant event. Okay. So triggers can be internal, like a memory or thought, or external, like sound, smell, or situation. So to arrange, uh, they can lead to a range of responses, including flashbacks, anxiety, or other intense negative emotions. Okay. So triggers when emotional. So triggers, whether emotional, behavioral, or database related, matter because this can significantly impact our well-being, the decision making, and even the integrity of our systems. So recognizing and understanding triggers is crucial for managing reactions. So fostering personal growth and ensuring smooth operations in various contexts. Okay. Next is common triggers. Okay, let's look at it one by one. So first is environmental trigger. So physical objects or surroundings in person's environment that spark intrusive thoughts or ritualistic behavior. For example, dirt, dust, stains may trigger contamination obsession. Open door, crooked frames, messy rooms may trigger symmetry or just right compulsions. Okay. Then people might avoid certain rooms or places, clean excessively, or check surroundings repetitively. Okay. Then next trigger is internal trigger. So thoughts, feelings, bodily sensations, or mental imagery that acts as triggers. Okay. For example, a sudden thought. What if I hurt my mother? A feeling of unease. Something doesn't just feel right. A mental image. A violent or inappropriate picture flashing in the mind. So, a bodily sensation of tingling or tightness leading to health fears. Okay, these triggers are often the most distressing because they feel like they come from within. People may engage in mental compulsions like repeating prayers, counting, or replacing the thought. Next one is situational trigger, social trigger, sorry. In social trigger, we see is interaction with others or social contexts that trigger OCD responses. Okay. So, for example, fear of saying the wrong things may trigger repeated mental rehearsals before or after a conversation. Then next is fear of judgment. So, avoiding social events, seeking reassurance repeatedly, hearing about someone's illness. So, triggering contamination fears. Okay. So relationship conflict might be there, triggering doubts like, do I really love them? So this is the relationship OCD. Okay. So it may lead to over apologizing, social withdrawal, or compulsive checking of social media or texts. Okay. And the last common trigger is situational trigger. The specific events or routine that tend to activate OCD symptoms. For example, leaving the house. So constantly checking locks, gas, taps repeatedly. Then it triggers harm obsessions like did I hit someone? Then religious events. It can activate scrupulosity of religious OCD. Okay. Then bedtime triggers uh, rituals like arranging pillows, checking lights, saying prayers repeatedly. The impact might be these triggers are often linked to daily routines, making OCD harder to avoid or escape. Okay. So next thing. How are these triggers maintained? How do we manage it? Okay, the main part. Okay, so first one is cognitive biases. So people with OCD often have distorted thinking patterns that keep the triggers active. For example, catastrophizing. If I don't wash my hands again, I'll get a deadly infection. Then another example for cognitive bias is the responsibility. If I don't check the gas again and there's a fire, it will be all my fault. Then I must be 100% sure the door is locked or I can't leave. These thoughts can make the trigger feel more urgent and dangerous than they actually are. Okay. Then next is compulsions. Okay. So each time okay. All right. The second one is avoidance behavior. So people with OCD often avoid triggers to prevent anxiety. So these seems helpful short term but causes long term problems. For example, avoiding public washrooms, avoiding knives, avoiding people. Avoidance prevents the brain from learning that nothing bad would have happened without the compulsion. Okay. The next is reinforcement through compulsion. So each time a person performs a compulsion, it reduces their anxiety temporarily. This is called negative reinforcement. Okay. So the brain learns is doing this behavior reduces stress. And the result of it would be the person keeps repeating the behavior whenever they are triggered. Okay. For example, trigger is intrusive thoughts about germs. The compulsion would be washing hands. The relief would be anxiety goes down. And the reinforcement would be brain says do it again next time. So even though it feels like relief, the brain associates the compulsion with safety, keeping the OCD loop alive. Okay. Okay. Let's take a poll. Okay. Is OCD always genetic or does distress alone cause OCD? What do you think? What is the reason of causing OCD? Is it genetic or is it the stress? Okay.
I think both can cause OCD.
Yes. Yes, it's correct. It's a combination of both. Okay.
Mm.
It's environmental, it's genetic, it's psychological. So environmental and psychological comes together being a stress, and genetic is also there. Okay. All right. So let's look at the common misconceptions about OCD. So what people think is OCD, but it's really not. People have many misunderstandings of OCD. People just, if people are cleaning a lot, people just go and say, "Oh, do you have OCD? Are you OCD person?" No, it's a misconception. Okay. Yes, the first one is OCD is just being clean or neat. So people with OCD just think that they are organized and clean. But the fact is, OCD is not preference. It's driven by anxiety and fear. Okay. So while contamination OCD does involve cleanliness, it is fueled by distress and compulsions and not enjoyment. Okay. So many people with OCD don't have cleaning related symptoms at all. Someone with harm OCD may obsess over thought of hurting a loved one, not cleanliness. Okay. Next is people with OCD can just stop their behaviors. Okay. So OCD is just a habit with discipline. It can be stopped. OCD is not a willpower issue. It is it's a neurological condition. Okay, involving brain circuits and neurotransmitters. So people with OCD often know their thoughts are irrational, but can't control the compulsions. Saying just stop is like telling someone that with asthma, just breathe normally. Okay. Next is everyone is a little OCD. We all double check or like things organized. That's right. OCD is there. true OCD is debilitating. It interferes with daily life, relationship, and emotional well-being. Preferring things neat or lying morning routines is personality trait, not a mental health illness. Okay. This phrase trivializes a serious disorder and discourages people from seeking help. Okay. So this is the common misconception. Let's look at the environment. Okay. So first question is what environmental factors like childhood trauma or stress might contribute to someone developing OCD. Okay. So children exposed to neglect, abuse, fear, loss, or frequent criticism may develop compulsive behaviors to regain the control or feel safe. So trauma can dysregulate the brain's fear and impulse control circuits. Okay. So an example would be a child grew up in a chaotic household may develop the strict rituals around organized and common control as a coping mechanism. Okay. The impact would be increased risk of intrusive thoughts, hypervigilance, and compulsions to manage emotional discomfort. Okay. So have you ever noticed how life experiences shape our behavior and how diverse can all brain pathways increasing vulnerable to OCD? A person might feel in danger even when logically safe, promoting compulsions or neutralize that false threat. Okay. So the brain areas that might get affected is orbitofrontal cortex. So it's responsible for decision making, evaluating, and filtering into thoughts. And also the of course is overactive, making intrusive thoughts feel more urgent and distressing. For example, you touch a dirty surface. So OFC, that is orbitofrontal cortex, wrongly interprets it's in danger, triggers obsessions or about contamination. Okay. Then next is anterior cingulate cortex. Okay, it is involved in error detection and emotional regulation. In OCD, it's hyperactive, making people feel that something is wrong even when it's not. For example, you lock the door, but something does not feel right. Better check again. Okay. Then next is neurotransmitters in OCD. So there are two of them, neurotransmitters, serotonin and dopamine. Glutamate is also there, but let's look at these two first. In serotonin, most well known in OCD, it helps regulate mood, impulse control, and anxiety. In OCD, often low serotonin levels are associated with poor control over intrusive thoughts and and having the emotional regulation. Okay. The dopamine is it involved in a reward habit formation and reinforcement learning. The next is glutamate. Okay. Then let's look at the impact of childhood trauma. Okay. Early trauma alters brain pathways, making it harder to regulate fear, impulses, threat uh, to the body. Okay. So during childhood, the brain is still developing. When child experiences trauma, it puts stress system into overdrive. Repeated or intense stress rewires how the brain responds to threat and anxiety. Okay. The result is the child grows into an adult with a brain that's hypersensitive to danger even when nothing exists. Okay. Okay. The next is heightened
Excuse me.
invul. Yes, Utkarsh, you want to say something?
Hello.
Yes.
Can you please repeat the last part of brain area?
Okay, we'll repeat it in the end. Right now, we'll go ahead. Okay.
Okay. Okay. Thank you.
Yes. Yes. Okay, there's it increases sensitivity to intrusive thoughts, impacting the childhood. There's unwanted, disturbing thoughts that pop into the mind, and it remains throughout the um, journey in our life. So, trauma survivors often develop hypervigilance. This means they notice and focus on distressing thoughts more intensely than others. Okay, they may also be more likely to interpret the thought as dangerous or meaningful. For example, a single intrusive thought can spiral into anxiety and compulsions. Okay. Then raising OCD risk. So, how this leads to OCDs is the combination of overactive fear circuits, poor impulse control, intolerance of uncertainty, intense guilt or shame over intrusive thoughts creates a perfect storm for OCD to take root. Okay. The cycle goes is intrusive thoughts, then distress, then compulsion, then the temporary relief, the thought returns, and there's a stronger compulsion now. Okay. Okay, we have seen childhood impact. Now let's see how the environment impacts. Okay. So let's take a case study. Nina was 10 when she experienced the trauma of losing her father in a car accident. Okay. Over the years, she began compulsively checking locks to feel safe, often spending hours ensuring her home was secure. So this habit grew into full-blown OCD in her teenage years. Okay. So this what happened in this case is the accident of her father interfered with daily functioning and her relationships. Okay. So the symptoms in this case were the intrusive thoughts, the obsession of if I have locked the door or not, and checking it constantly. Repeated neutralized behavior. The behavior was she was continuously going and checking the doors if she has locked it or not. Okay, and there was significant distress or impairment due to that in her teenage years. Okay. So how the accident of her father affected her teenage years and how did it impacted her childhood? We can see it. Right? Okay. We have seen how the childhood trauma has impacted. Let's see how genetics impact. So does anyone here know if OCD or similar behaviors run in your family or not? Is it true that it's genetic? Just give a thumbs up if you feel that. Yes. Many people are saying yes. Okay, someone is saying to some extent. All right. Let's look at it. So, yes, OCD tends to run in families, suggesting a strong genetic component. Okay, so what research says in this case is so first degree relatives uh, of someone with OCD are up to 4 times more likely to develop it. So twin studies. So someone who are twins reveal that identical twins have much higher concordance rate. If one has twin OCD, if one twin has OCD, the other is much likely or more likely to have it too. Okay. So OCD has a 45 to 65% heritability rate, and families, identical twins are more likely to have both OCD compared to fraternal OCD, fraternal twins. Okay. Then next is specific genes involved. So no single OCD gene has been identified. Likely involves multiple genes, especially those regulating serotonin, dopamine, and glutamate. Okay. The gene environment interaction. So, genetic vulnerability alone does not cause OCD. Okay. So, environmental factors can trigger OCD in someone with predisposition. So, for example, a person with family history of OCD may only develop symptoms after experiencing a highly stressful event. Okay. Okay, we have seen childhood impact, we have seen genetic. Let's see the psychological factors. Understanding how person with OCD thinks. Okay, okay. Let's do it all together. Okay, close your eyes. I hope everybody is doing it with me. Just close your eyes, sit calm. Okay, imagine that you are at home. Okay, thinking about how you hear footsteps outside and need to lock the door. Okay. So you're sitting down, you're imagining, closing your eyes and imagining that you're at home. You're thinking about hearing the footsteps outside and you need to the lock you need to lock the door now. Okay. So your inner voice is saying need to check the lock repeatedly 50 times in an hour. Okay. So the our inner voice is continuously saying go, get up and check if the door is locked or not. Go get up and check if the door is locked or not. Okay. So each time it grows louder and more urgent. It's locked, right? I am safe, right? So these kind of thoughts just start to come in. All right. So the thought does not stop. The need to check the safety lock is constantly there. Okay. All right. I'm so sorry. Okay, so first one is cognitive distortions. So people with OCD often show distorted thinking, such as expecting the worst. So if I don't pray 5 times, something bad will happen. Then believe that you are to blame for preventing harm. So if I forget to check the stove, the house might burn and it will be my fault. Then believe that thoughts can cause events. Thinking about an accident will make it happen. Truly. Okay. The next we see is perfectionism and control. So many with OCD have high internal standards or fear of making mistakes. So they struggle to accept good enough. This leads to excessive checking, organizing, or redoing tasks. Okay. Then there is thought suppression. So trying to push away intrusive thoughts can backfire, making them more frequent and distressing. So this creates a loop of intrusive thought, attempt to suppress, thought returns, and more anxiety. Okay. The next is early learning and conditioning. So people may have learned compulsive behavior through reinforcement. When I washed my hands, my anxiety goes down. Over time, these behaviors get repeated and strengthened. Okay. Next is early learning and conditioning. People may have learned compulsive behaviors through reinforcement. If I wash my hand, my anxiety goes down. Over time, these behaviors get repeated and strengthened. Okay. Next is trauma and life stress. Trauma, neglect, abuse, or loss can reshape how a person experiences fear and control. These environmental wounds often drive obsessions and rituals to stay safe. Okay, let's look at the case study. A 28-year-old accountant constantly fears he might leave his store and on and cause a fire. Obsession in this case is there are intrusive thoughts about the stove being left on trouble him daily, even at work, because he forgot to check before leaving, and now he has constant those thoughts. Then compulsive behavior in this case is to ease his anxiety, he checks the stove repeatedly, up to 30 times before leaving home. Okay. It feels powerless for them to stop losing hours of his day to these rituals. Okay. All right. Let's take a short break. So just like in YouTube, if it's free, there's an ad, right? So yeah, let's take a short break. Also, let's look at the benefits of one-on-one counseling with MindTribe. Okay, so what is one-on-one counseling? Let's dive in. So it's personalized, confidential chat between you and a trained therapist. Imagine having someone who really listens and understands you and helps you figure things out. The benefits: personal growth, solving problems, setting goals, and boosting your mental well being. It's like having a personal coach for your mind. Okay. The counseling misconceptions that many people have. Mm, let's bust a big myth about it. Many think counseling is only for those who are unwell. No, that's not true. Counseling is for everyone, anyone wanting to be their best self, want better relationship, more friends, a spot in your dream college or job. Counseling can help them with all of that. It's about making the best version of you. Okay, so why choose Mind Tribe counseling? Let's look at it. First off, our counselors are super talented. Plus, we are super affordable with session ranging from rupees 900 to 5,000. And guess what? Your first session is just rupees 249. Once you're comfortable, you can choose our affordable packages, empowering minds, transforming lives. That's what we do at MindTribe. Okay. If anyone is having question about it, just tell me now. Okay, raise your hands.
Does medicine help in OCD?
Am I audible?
Yes, you are audible, but where? Ma'am, कहाँ गई?
I think she
Yes,
left.
you are audible.
Or
No, no, I'm here. Yes, you are audible.
Hmm. Can you please repeat the last part of brain area?
I'll repeat it in the last, okay?
Okay, okay. I think it is about to end. That's why I asked that. Sorry.
Does medicine help in OCD like SSRI?
Ma'am, does medicine help in OCD?
Yes. Yes, it does help, but along with that, you need to take therapy. So if it's extreme OCD, yes, you need to take medicine along with therapy. But if it depends on the therapist. Okay. So if you're taking therapy sessions, they'll take your assessment and everything. Okay, and they'll let you know that if medicines are needed or not. Okay, they'll guide you through it.
Ma'am, I have pure OCD. Whatever I do, the thoughts automatically comes in my mind also while sleeping. What should I do?
Okay. In the end, we'll give you the few tips. Just go through those tips. Try doing it at home. Try managing it at home. If you are not able to do, you can take our therapy sessions and we'll help you out. Okay.
Okay, okay.
Yes. Let's take a 2 minutes break. Then we'll start again. All right, let's begin. So, many people have that question: is OCD curable? Um, so, OCD is not usually curable in the traditional sense, but it is absolutely treatable and manageable. Okay, often to the point where symptoms no longer interfere significantly with the daily life. Okay, all right. So OCD is considered a chronic mental health condition like diabetes or asthma. So it may not go away completely, but it can be effectively managed with the right tools and support. Okay. So many people experience periods of remission where symptoms are very mild or even absent for long periods. Okay. So studies have shown that about half of patients seeking treatment for OCD achieve a significant reduction in symptoms over the long term. Okay, let's look at the case study again. Okay, so Tanya is a 24-year-old architecture student, had a peculiar habit. She had to count every step she took. Okay, so walking up the stairs, crossing hallway, or even moving from her bed to the bathroom. She had to count each step in multiples of four. Okay. If she miscounted or ended on the wrong number, she had to start over, all over again. Because she had that constant behavior or constant thoughts in her mind. Okay. So, what were the symptoms and struggles for her in this case? Let's see. So, if she didn't complete the sequence correctly, she felt a deep sense of doom, convinced something terrible would happen to her or her loved ones. Okay. So her intrusive thoughts were, if I don't stop exactly 16 times before entering class, I might fail my exams. She had those specific count of numbers to reach that specific destination. Okay. So this compulsion slowed her down significantly. She sometimes missed buses, got late for lectures, even avoided walking in open spaces where counting became harder for her. So she felt trapped in her mind, knowing the behavior was irrational but unable to stop. Okay. So study have shown that with proper treatment, 50 to 70% of individuals with OCD experience significant reduction in symptoms. Okay. So many regain full or nearly full functioning in daily life. So early intervention improves long-term outcomes. All right. Okay. Let's see how can therapy be helpful. How we as a psychologist can be helpful to treat OCD. Okay. So it's pivotal in addressing OCD as it equips clients with tools to understand, manage, and reduce the impact of their symptoms. So let's break it down. Okay. So first and foremost thing is understanding OCD. Okay. The psychoeducation. So clients gain knowledge about OCD's mechanism, including the obsessions and compulsions that we have learned before. And understanding that OCD is a disorder of misinterpreting normal intrusive thoughts that helps clients externalize their symptoms and reduce self-blame. Okay. So externalizing OCD. So clients are encouraged to view OCD as a separate entity rather than an intrinsic part of themselves. This helps to reduce its emotional hold. Okay. Next is CBT, cognitive behavioral therapy. So it is widely regarded as the most effective therapy for OCD, focusing on the relationship between thoughts, emotions, and behavior. So in this case, we use this exposure and response prevention. It's a gold standard for treating OCD. Okay. So it has two components: exposure and response prevention. Exposure is gradually and systematically exposing clients or to anxiety provoking stimuli related to their obsessions. Okay. And the response prevention would be helping clients resist performing compulsions to reduce anxiety, allowing them to habituate to the discomfort. For example, a client with contamination fear might touch a dirty surface and refrain from washing their hands. So over time, their anxiety decreases as they learn that the feared outcome does not occur. Okay, so in this case, what happens is it reduces avoidance behavior, it breaks the cycle of obsession leading to compulsions, and it increases the tolerance for uncertainty and distress. So, how it helps the clients is clients realize that anxiety decreases naturally over time due to habituation. They gain confidence in managing their fears without relying on any compulsive behavior. Okay. Then next we do what we do in CBT is cognitive restructuring. So this component helps clients identify and challenge irrational beliefs or cognitive distortions. For example, people have thoughts of if I don't take the stove, my house will burn down. If something bad happens, I will be at fault. So we as a therapist guide clients to reframe these thoughts into more balanced and evidence-based perspective. Okay. The next thing third one is mindfulness based intervention. So along with CBT, we practice this. It involves being present in the moment without judgment, observing thoughts and emotions as they arise, and letting them pass naturally. Okay. So what we do in this case is detachment from the thoughts, reducing rumination. That is, cycle of overthinking is interrupted and dwelling on intrusive thoughts. Okay. Then we teach anxiety management techniques. Many other techniques are taught. Then comes the practical example. Okay. So, a client with harm related obsession might practice observing the intrusive thought. What if I hurt some? So, without judging or reacting to it, over time they learn to let the thought pass without engaging. Okay. All right. Next one is developing coping skills. Okay, how do we develop it? So we develop the alternatives to compulsions. Okay, example deep breathing or progressive muscle relaxation. We teach few grounding techniques which help them. Okay, there are also self-soothing techniques where clients engage in self-compassion and remind themselves of past success in managing OCD. Okay. Next is improving self esteem. So, OCD can erode a client's confidence and sense of self worth. We, as a therapist, build self compassion, celebrate small victories like resisting a compulsion or facing a fear situation. Okay. The last thing, the relapse prevention. So the client and therapist collaborate together, identify potential triggers and warning signs of relapse, and according to that, we develop a personalized plan for handling the setbacks. Okay. Okay. Next is looking at the emotional issues. So clients suffer with lots of fears of uncertainty, the need for control, or deep-seated fear of harm. So therapy helps explore and process these underlying vulnerabilities. Okay. Next is support system enhancement. So we also involve family or close friends if needed because it's beneficial. We educate their loved ones about OCD to reduce misunderstandings, encourage them to stop accommodating compulsions, and teach them how to support the client effectively. Okay. The next thing is tailored intervention. So we also practice many other approaches like acceptance and commitment therapy. So we make clients learn to accept intrusive thoughts and commit to live a meaningful life despite OCD. Okay, so it helps reduce self-criticism and cultivate a sense of inner safety. Okay, so yes. Before we jump into the main discussion, here's a question for all of you. On a general basis, how often would you hear yourself or someone diagnosed with OCD asking this question? Am I okay? Am I doing this right? To any one of you, to your loved ones, to yourself, or you say to other people. So, on a scale that says often, sometimes, rarely, never, how have you heard it or how have you said it? Do you say it often, sometimes, rarely, or never? How is it? Yes, some people are saying sometimes. Yes, I see many people are saying sometimes. Okay, Gautami is saying often, pretty often. Okay, okay. So there is a complex behavioral pattern that OCD sufferers show beside their obsessions and compulsions. This pattern is characterized by excessive reliance on others for approval, identity, and emotional well-being. Okay, so people suffering from OCD due to their perfectionist ideas, constant anxiety, and self-esteem issues have this constant urge to seek reassurance from their loved ones. So these loved ones be friends, family, friends, spouse, etc. So now showing an unhealthy emotional dependence on a caregiver can manifest in different forms. First of all, it can turn out to be distressing on the caregiver's part as well. We would often see them frustrated, stressed, and disappointed in their relationship dynamics. With person with OCD, it can often also be challenging for the loved ones to understand the person's fears and obsessions. Secondly, it can make the OCD sufferers from directly working on the disorder and avoiding going for treatment. Okay. Now, next is OCD and overdependency. One of the most common feature of being overdependent in OCD sufferers is reassurance, seeking the seeking it constantly. So this mostly result from the lack of confidence in their own judgment. Okay, in their thoughts, in the behaviors, perception of themselves. Now, there is a clear distinction between reassurance seeking behavior in general and one that OCD sufferers carry out. So, people with OCD indulge in what is called excessive or persistent reassurance, seeking that gets them being codependent on their caregiver. So thoughts like, am I okay? Did I turn the gas stove off? Did you clean your hands before cooking dinner for me? Am I a bad person? Etc. Quite commonly pass through minds of such people. So these thoughts often push them in a space of uncertainty and doubt, wherein they feel a need to immediately seek validation from their loved one. Okay, they need to check what they think is true and not true, and therefore gain certainty to reduce their feelings of anxiety. Okay, this can also take different forms. For some, it might simply be asking for approval and validation, while for others, it may be asking the loved ones to engage in the compulsive behavior with them. For example, asking them to watch whilst they complete a hand washing ritual to check if it was done correctly. As appears on the screen, this is how reassurance works. Okay, however, this temporarily reduces the person's sense of threat and uncertainty in the short term and the long term. It increases the urge to seek this repeatedly whenever the anxiety or obsession thinking returns. Therefore, a vicious cycle instead gets set up that feels like another trap that OCD has set up alongside carrying out their compulsions. People with OCD feel an irresistible need to engage in excessive reassurance, seeking what often worsening their symptoms. Okay. All right. Let's look at the cycle. So what happened is the road towards the independence. What are the first steps to build self-trust and setting healthy boundary within the relationship? Okay, the first step is awareness. Okay, first make a list of all the things you seek reassurance for. Okay, guys, this is the tip that I'm giving. Just pay attention to it. Okay, so what you'll do is first is awareness. Make a list of all the things you seek reassurance for. Then put them in an order of how difficult this would be to give up. Okay. Next, pick the one that is easiest to give up. Okay. And try resisting this one. So this awareness helps identify those patterns that are keeping the person stuck in the reassurance cycle. Okay. Second, the individual learns to pause. So, this is a small but powerful practice. Instead of instantly asking, did I do this right or am I okay? They learn to pause. Okay. They learn to pause and sit with the discomfort, even if just for 30 seconds to begin with. Okay. One way to do this is to practice mindfulness and create a new relationship with your thoughts during this pause. Okay. So we have seen two things. Third thing is behavioral experiment. Uh, this comes experimenting with self trust, carrying out behavioral experiments where the person gradually tests their own judgment without external confirmation. For example, instead of asking a partner if the stove is off, they can decide, I saw myself turn it off, right? I trust that my memory is good. I'll hold on to that trust for now and resist asking to someone else. Okay. So these experiments slowly rebuild their confidence in their own perception. All right. Next, the fourth thing is setting boundaries. It is also a key. For the person with OCD, this means learning to communicate openly with your loved ones. I know I usually ask you for your reassurance, but I'm trying to work on that. Okay. It's hard that I might still ask sometimes, but you can gently remind me to try and sit with the uncertainty. Okay. Ask your loved ones to not answer your question. Just sit with your thoughts and imagine that have you done the things or not. Resist. Try to resist those thoughts, those behaviors. Okay. And for caregivers, it means learning to support without enabling. That is trying to validate not their thoughts but their feelings. Okay, for example, for a person with OCD asking you, am I a bad person? Now, instead of directly reassuring the person with, hey, no, you're not a bad person, respond by saying that I'm sorry. You're again feeling this way, but remember that I love you and I'm there for you. I'm here for you. Okay. Thus, it involves the caregiver being empathetic but firm. Okay. So, thus, while navigating this journey of self healing from OCD or dealing with somebody with OCD, it is imperative to understand that healing would not be about completely eliminating the connection, okay, with your loved one. It's about reshaping it in such a way wherein we are clearly able to distinct between creating a supportive environment and dependent environment. Okay. Okay. So let's understand the cycle first. Okay, the OCD has four main parts: the trigger, obsession, anxiety, distress, and compulsion. Okay, so the relief is temporary in this case. So the goal
Ma'am,
is,
can I ask something?
yes, go ahead.
You said that some brain parts like orbitofrontal cortex are um, active in brain that causes
Yes,
OCD. Is
yes.
there any physical damage in these brain parts?
Your voice is not clear.
Is there any physical damage in these brain parts?
No, no, no. There is no such physical damage in the brain part. It's just a mental condition where your neurotransmitters, that is dopamine and serotonin, it just gets it's there an imbalance over there. That's why this causes are there. Okay.
Okay, thank you.
All right. Moving ahead. So, how to break the link between this cycle that you can see on the screen? Okay. First is awareness. Second is pause before reacting. Okay. In this case, awareness is what just triggered this thought or urge me. Recognize that trigger and obsession for what they are. Okay. This is label it like this is just an intrusive thought. I just had a thought that I might harm someone. That's my OCD and that's not me. Okay. Just become aware of what you're thinking. Okay. The next is pause before reacting. So, can I delay this compulsion even for 30 seconds? Ask yourself. Ask this question. Even a brief pause helps disrupt the habit loop. Okay. Over time, pausing builds mental muscle. So, for the tip to pause this is use 5 4 3 2 1 exercise. Okay, it's a very good exercise. So in this case, what you'll do is, if you want to stop that compulsive behavior, you'll this five you will you'll have to resist it. But you cannot resist it, so what you can do is, instead, while resisting, you can practice one of the um, grounding technique, that is 5 4 3 2 1 exercise. So in this, five in it includes is looking at the five objects that are there near you. Just look at it, what it is, how it is. Just look at the five objects and name it on your own for yourself. Okay, then coming to the four, touch the four things around you. Okay, go and touch the things around you. See how the texture is, it how is the surface, how is that thing, is it soft, is it hard, look at it. Okay, then next is three. Okay, um smell three things around you. Okay, look at it, how it is. Okay, how the smell is. All right, then coming to the two, hear two things around you. What is going on around you? Here, are you able to hear anything around you? Look at it, what people are saying, or are there any birds or animals around you? Okay, and the last thing is taste. Taste one thing. Either if you have anything in your mouth or on your tongue, just uh, see how the taste is, or you can just go and eat something and see what the taste is. Okay, so this is the exercise you can do to resist your compulsive behavior. Okay, then next is validate your thoughts and feelings. Tell yourself that it's okay to feel anxious without needing to fix it. Okay, remind yourself that thoughts are not actions. Okay, feeling anxious does not mean something is wrong. And mantra for you in this case is, I can feel uncertain and I can still be okay. Okay, all right. The main thing again, how to manage OCD at home. Let's look at it. Okay, so living with OCD can be overwhelming, but with the right daily strategies, it is possible to reduce symptoms and regain control. So, home based management complements therapy and helps build long term resilience. Okay, so first one is structured routine. So it reduces uncertainty, adds predictability and control. So it prevents rumination and compulsive time loops. So how to apply this is, there should be wake up and sleep schedule, dedicated time for meals, study, hobbies, breaks. Okay, so limit ritual time, that is bathroom and checking. Um, yes, someone's mic is on. Please off it. It's disturbing the workshop. Okay, Suryansh, I'll request to switch off the mic. Yes, great. Thank you for that. Okay, so yeah, we were looking at structured routine, and yeah, dedicate your time for meals, study, hobbies, and breaks. Limit your ritual time. Okay, start small, structure just mornings, then build up the whole day. Okay, go slowly, take one step at a time. I know it's hard to do, but yeah, slowly doing it will help you a lot. Okay, second is support system. So this helps in reducing the isolation and shame that we have in our mind. It provides accountability without enabling compulsions. So choose one or two trusted people to confide in. Share with them what happens with you, what helps for you. Okay, ask your loved ones to avoid giving excessive reassurance. Limit your reassurance from them. Okay, and practice that I am working on not asking if the door is locked. Please don't answer if I ask. Okay, tell them that even if you ask them, ask them that to not answer the question. Okay, this will help you to resist, and this will help you to sit down with your thoughts. All right, next is the relaxation technique. So it reduces the baseline anxiety, which lowers obsession triggers. It helps the urge response pattern. So for example, you can practice this 4 7 8 deep breathing. Okay, so inhale for 4 seconds, pause for 7 seconds, and exhale for 8 seconds. Okay, the next is body scan meditation. So sit with yourself throughout the day, sit with your thoughts, scan your body, look at your body parts, and do the meditation for it. Then next is progressive muscle relaxation. Make sure that you relax your muscles, you move your body throughout the day, go for long walks, the nature walks, the mindful movement. Also, in this case, you can do a stretching and yoga. Okay. And the next is self help tools. Okay. So, what you can do is read about the OCD workbooks if you have. There are mental health apps like NOCD and MindShift. Okay. Then there is tracking tools for exposures and urges. Also, you can practice gratitude and maintain your mood journals so that it can help you. Okay. So, next is exposure and response prevention. So, it teaches your brain that anxiety can fade without rituals. So identify a fear or obsession. Create a small exposure challenge. Resist it with the compulsion. Sit with the anxiety until it reduces. Okay? Just look at it. For example, touch a doorknob. Resist hand washing. Feel the anxiety fade. I know it's hard to do it, but yes, slowly you'll practice, you'll be able to resist those behavior. Okay. Start with low level exposure and move up gradually. The next is reassurance. So, reassurance feels good short term but strengthens OCD long term. So, how to apply it is delay asking, reduce frequency and then gradually eliminate it, and replace it with the grounding statements. For example, I can live with this doubt. I can live with this doubt. So this is the constant reassurance you can give for yourself. Okay. Next is healthy lifestyle. So it supports the brain chemistry, mood, and regulation. So regularly sleep for 7 to 9 hours at night. Regularly exercise at least for 20 to 30 minutes. Have good meal. Hydrate yourself and reduce caffeine. Okay. All right. Then last one is thought diffusion. So separate you from your thoughts, reduces emotional attachment to obsessions. So how to do it? Label the thought. I am having the thought that. So label your thought that I am having this thought, I am having that thought. Visualize it floating away on a leaf or a cloud. Okay. So repeat a silly version of it to reduce its power. Okay. For example, uh, I might hurt someone. Turn it into I am having the thought that I might hurt someone. Okay. Just turn your thoughts that it's just a thought and it's not you. Okay. Okay. So we have seen these all 8 techniques: the structured routine, support system, relaxation techniques, self-help tools, exposure and response prevention, reassurance, healthy lifestyle, thought diffusion. Okay. So which of the
Ma'am,
techniques would you want to try to manage OCD at home?
please also give some tips for pure OCD.
So these are the tips for pure OCD only.
Okay.
Yes. So come on, which one would you be trying, or which one are you trying already? Tell me. Yes, Salvi is saying all of them. Tanvi is saying thought diffusion would work for all. Yes, absolutely. All of them will work for all of you. Okay. Anyone who is having OCD, it would work on them. Okay. Okay, Mukund is saying that I'm trying leaves on a string. All right, that's great. Keep trying it, resist your thoughts, visualize your thoughts, let it pass.
Ma'am, I want to ask something.
Yes.
I have pure OCD and I feel pain in my head. Is it normal?
What come in your head?
I feel pain in my head.
Okay. Have you consult any general physician for this if you have pain in your head?
Not
Yes. If it's there for long term, just consult a general physician for for the headache, and also you can try therapy if you feel that you have OCD. The
I
psychologists
want to
might
ask
just
that
take.
is it
Yes.
due to thoughts come in my head or is it something other?
Okay, so I cannot tell it right now because it needs a therapy session to be taken. We need a case history, and then we'll be deciding the reason for it. Okay, so we'll
Okay.
have to look at. Yes. All right. Okay, so what were the takeaways for today's workshop? Let's see. So we have understood OCD, which is the first step to healing. So it's not about clean, organized, or dramatic. It's real, this diagnosable mental health condition that involves intrusive thoughts and compulsive behaviors. Second, it's OCD operates in a cycle, okay, and it can be broken. The cycle is obsession, then anxiety, then compulsion, the temporary relief, and the repeat awareness of OCD cycle helps break it. Okay, so learning to pause, resist compulsions, and tolerate discomfort is central to healing. I know if you resist your thought, it will be very uncomfortable for you, but try with 30 seconds and gradually you can move ahead. Okay. Then ERP is the gold standard treatment. Okay. It's evidence based and effective one. Facing fears without performing compulsions help retrain with the brain. Okay. And next is triggers are not enemy. Avoidance is. Okay. So you can learn to live alongside triggers without fear. Identify your personal triggers. Learn how compulsions and avoidance maintain OCD and practice strategies like thought diffusion, mindfulness, and boundary setting. Okay. So OCD has multiple causes and none are your fault. Okay. It arises from a combination of genetic, neurological, psychological, and environmental factors. Okay. So childhood trauma, stress, and personality traits like perfectionism can increase risk. Okay. But having OCD does not mean you're weak or broken. Okay. Okay. You are yourself. Self compassion is a powerful tool for it. Okay. Talk to yourself like you would talk to a friend with OCD. Comfort yourself. Guilt and shame and self judgment keep OCD alive. Okay. So kindness and self acceptance create space for healing. Be kind to yourself. Accept the situation. Accept the thought. Resist your thought. It would help you a lot. Okay. So you have your toolbox now. Use it. Okay. Your OCD toolbox includes the structured routine, relaxation technique, support system, coping statements, self-talk strategies, home-based management techniques, and much more. Okay. So you're not alone. OCD can feel isolating, but there is a help and hope. Okay. Support groups, therapy, and online communities are available. So OCD does not define you. Recovery is not linear, but it is possible. Okay. So what's one insight you're taking from this workshop? And what's one step you'll take this week to support yourself or someone with OCD? So what's the step you're going to take now? So what have you learned from this? Was it helpful? Was the workshop helpful for you all? All right. Okay, so Gautami has few questions. Let's look at it. Okay, can some types of OCD go undetected if they have developed coping mechanisms in their childhood? Okay, so you are saying that someone has undetected OCD and they have developed the coping mechanism in their childhood only. Okay, so if you have developed coping mechanism already, then your OCD has just disappeared. Okay, it has just gone on the lower surface. You cannot see it, nobody can see it, it cannot be detected because you're already managing it. Okay, which is a good sign. Okay, second question. Can OCD develop in later ages? Yes, it can develop at any age in life. Okay, it can come out at any age. Okay, the third question. What methods are used by psychiatrists or clinical psychologists to diagnose OCD in today's time? Okay, so basically, we look at the symptoms, what we look at your case history, and then we slowly diagnose it and we take the assessments, and then we come to know that if the OCD is there or not. Okay, okay, I
Hello.
focused. Go ahead.
Can you please summarize the brain area?
Yes, I'll do it. Give me 2 minutes. I'll just look at the response of people and then we'll go to brain. Okay, so many people have learned many things. I can see it in the chat box. Yes, I'm happy that you are taking many things away with you. Yes, I'll be summarizing the brain. Just a minute. Yes, people have started managing it by themselves also. Yes. Okay. So Salvi is asking that what are the chances that OCD symptoms might return. So if you have, it depends on you. Okay. If you have relaxed the from your daily routine, from your coping mechanism, you might have the symptoms back again. Okay. So you just have to manage yourself, manage your routine, manage your thoughts, be kind to yourself, and the symptoms will not come up. Okay. All right. Coming to the brain part. How does the brain areas impact in OCD? So, um, so what happens is there is orbitofrontal cortex. So it's basically responsible for decision making, evaluating risks, and filtering the intrusive thoughts. So in OCD, what happens is this orbitofrontal cortex is overactive. It becomes very much active in this case. It makes the intrusive thoughts feel more urgent and distressing. It's not able to control. So if you touch a dirty surface, the orbitofrontal cortex wrongly interprets it as a danger and it triggers your obsession about contamination. So this was about orbitofrontal cortex. Okay. So next is anterior cingulate cortex. So anterior cingulate cortex is responsible for error detection and emotional regulation in our body. So in OCD, it becomes hyperactive. It makes people think that something is wrong even when if it's not. Okay, everything is good. But sometimes due to hyper OCD and hyperactive in our brain, it detects wrong and we feel that something is wrong in our body or around us. Okay, then next is basal ganglia. Okay, so basal ganglia is responsible for movement and helps filter out unnecessary thoughts in our mind. Okay, so in OCD, this filter mechanism is faulty. Okay, so intrusive thoughts don't get filtered in this case, leading to persistent obsessions. Okay, so why this happens is because of the chemical imbalance in our brain. So it is influenced by our mood, anxiety, and behavior. Okay, the main thing that affects is serotonin, dopamine, and glutamate. This gets imbalances. So, serotonin is responsible for mood, impulse control, and anxiety. So, in OCD, what happens is low serotonin levels are associated with poor control over intrusive thoughts and emotional regulation. Okay, then dopamine is there. So, dopamine is responsible for reward, habit formation, and reinforcement learning. So if the in OCD, if dopamine dysregulation is there, it may reinforce compulsive behaviors by giving temporary relief. Okay. And then comes the glutamate. So glutamate is an excitatory neurotransmitter involving in brain signaling. So if there is an imbalance, it may lead to excessive activity in OCD circuits. So new treatments are being explored that target glutamate levels. Okay. This was about the brain part. Okay. Okay. I hope the brain part is clear.
Ma'am,
Yes.
does OCD themes change with time?
What? OCD?
क्या OCD की themes time के साथ बदल भी सकती है?
I didn't get your point. OCD का क्या चेंज होना होना मतलब what are you saying?
क्या OCD का थीम टाइम के साथ बदल भी सकता है, जैसे कि किसी को कुछ और है फिर 2 साल बाद कुछ नया थीम आ सकता है?
That depends on your thought pattern. Okay. If you're constantly thinking and if you have those intrusive thoughts, it might change or it might be same. If you're thinking a lot, the thinking pattern might change to something else also. Okay.
And also I want to ask something.
Yes.
क्या OCD के कारण फ्यूचर में कोई पागल भी हो सकता है क्या? लाइक कोई रोड पे घूमते रहता है, ये अगर किसी को देख लूं तो ऐसा थॉट आता है.
Okay, so that's what the therapy is there for. If you take therapy sessions, it's curable and it's manageable. Okay, and it won't affect you. Okay, all right, moving ahead. Mukund is saying that if I try resisting the obsessive thought, can that harm us if we aren't paying attention to it? So if you're not paying attention to it, it won't harm you. Okay, I know there is a fear, but if you distract your thoughts, your fear will gradually lower down. Okay. Abhishekta is saying how ERP methods help to control OCD and what are the basic steps of ERP. So ERP is taken by a psychologist. You need to go and have therapy sessions and they'll help you with it. Okay. Okay, Salvi is saying I take a long time to focus on my studies while my friend take 1 hour to remember a chapter. I take 2 hours. My thoughts don't settle so that I can focus. What can I do in this case? So I've taught about mindfulness techniques, the meditation, so you can practice those things. Okay. All right. Yes. So before we end, healing from OCD is not about eliminating every intrusive thought. It's about changing your relationship with them. Okay. You are stronger than your compulsions and you're not your thoughts. So recovery begins when you start responding differently, and that journey has already started. Okay. So yeah, that's it for the session. If you have any question, please drop it in the chat box.